If you are experiencing recurrent fractures, curved upper spine, or sudden back pain, then you need to speak with your healthcare provider because you may have to evaluate your thyroid gland function. Your genes determine the potential size and strength of your skeleton. All of us are born with a predetermined amount of bone mass we will be able to build. This is determined by our genes. Along with the genetics, our internal and external environment determine the bone health. External factors such as our diet or physical activity affect the bone health throughout the life, and these things can be controlled. Bone strength comes from bone density. Your bone density is how porous your bones are. If your bone has fewer pores, then it has good density. Bone density is vital as we age because less dense bones are more likely to break, even from routine run-of-the-mill injury like tripping and falling off a curb. It is predetermined by our genes how dense bones we are going to build, but not everyone can reach that peak density. Up to 20s, we hit our peak mass. During this whole process, bone modeling takes place, and after that, bone remodeling occurs. What happens in the remodeling? There are 4 types of cells in the bone. Every cell is located at unique locations and provides unique functions, out of which osteoclast breaks old bone and osteoblast forms new bone. This process is balanced so that all bones are formed to meet the changing needs of the body as we get older. Remodeling also helps to repair any small damages to bones. This process is essential for living a healthy life. Our whole body functions are based on this process. Many hormonal disorders can affect the bones. Parathyroid hormone plays an important role in regulating bone remodeling. Bones provide a basic frame to our body, but it is also a storehouse of some essential nutrients. This stores calcium and phosphorus mainly. The human body needs these minerals to function normally. When the blood levels of calcium fall and when cells need these minerals to function, they are acquired from the bones. The parathyroid hormone is secreted when the calcium levels in the blood are low and it takes out calcium from the bones. This hormone indirectly acts on the osteoclasts, interfering with the bone remodeling. In this situation, new bone formation takes place at low rate and the old bones are broken down at higher rate under the influence of parathyroid hormone. In short, when this hormone is released, it takes out calcium from the bones, and if it is released in high amounts, it can damage the bones by making them less dense. This condition where the bone density is low is called osteoporosis. In this condition, your bones can break very easily. In hyperthyroidism, the parathyroid hormone is released in high amounts when the thyroid gland is overactive. Parathyroid adenoma, hyperplasia, some genetic conditions, and parathyroid cancer can cause hyperthyroidism. Hypothyroidism is the condition where the thyroid gland is underactive. This means it provides less thyroid hormone. This condition itself does not cause osteoporosis. Taking too much medication for hypothyroidism can cause too much thyroid hormone to circulate in the blood. People with diagnosed cases of thyroid cases must be evaluated for bone density as they are at higher risk of developing osteoporosis. This can be done by bone density testing. It is done to measure the mineral density of the bones. Scanning must be done at 4 sites: 4 lumbar vertebrae in the lower spine, the femur or hip bone, the femoral neck, which is the skinny part of the hip bone, and the wrist. If your density is normal, you can wait up to 15 years for your next screening unless there are changes to your health status. Bone density can be different in different places, as the spine is the most metabolically active, which means it loses density first. So, when you feel low back pain, make sure you are not having low bone density. If you are diagnosed with osteoporosis in one area, that means you have it everywhere. Osteoporosis does not have treatment, but you can prevent further damage to the bones. Bone loss can be prevented by eating a well-balanced diet containing calcium-rich foods and maintaining normal vitamin D levels, as vitamin D is responsible for calcium absorption. Avoiding smoking, keeping your alcohol drinking within recommended limits, and exercising regularly. High impact exercises such as running and skipping strengthen your bones. Weight bearing exercises such as climbing stairs and yoga poses, which involve balancing on one leg, can improve the balance of your body, reducing the chances of falls and further injuries. A daily intake of 700 mg of calcium is recommended for everyone. If you want to know more about bone density testing, check my video link in the description box. Thank you for watching.